So today we'll be understanding the pathophysiology of preeclampsia. So preeclampsia की pathophysiology has been very confusing since the start. है ना, when even I was an undergraduate बड़ा मुश्किल था समझना. Many times we used to skip it. नहीं समझ में आ रहा है जाने दो. But now you can't do that. First of all, it is important to understand any basics. Second, since 2 to 3 years in NEET PG, pathophysiology is being repeatedly asked. So now you cannot skip it. And as such, it is not a difficult method, it's not a difficult thing to understand. You give me 5 minutes and I'll make you understand the whole pathophysiology, that what is happening in preeclampsia. So how do we describe preeclampsia? It is described a pregnancy specific syndrome. So mark that line, that it is pregnancy specific. It is indicating that it occurs only when the woman is pregnant and it affects virtually every organ system in her. So it's a pregnancy specific syndrome affecting every organ system. Let's see why. Why is it happening? So there are two things which are happening simultaneously. One thing, the main pathology is starting at the placental interface. जहाँ placenta है, at that feto-placental interface, the main pathology is starting. And because of that pathology, there is reflection into the mother. Certain mediators are released which travel into the mother, resulting in simultaneously development of maternal syndromes. So there are placental syndrome and maternal syndrome which are interconnected. What is happening at placenta? Normally what happens, basically normally what happens when placenta is invading inside the endometrium, if you know it is invading, there is also invasion of the spiral vessels. Spiral vessels of the mother are also invaded. That is why these thin vessels turn into big channels and pour their blood in placenta. So there is problem in this invasion. But why the problem is happening? It is actually the maternal intolerance to this new antigen. Mother को जो ये नया antigen मिला है, mother is showing intolerance to this new antigen. Mother is trying to reject this new antigen. अब वो properly तो इस new baby को reject नहीं कर सकती. It cannot reject it like any organ. So how mother is trying to showing its rejection? It will stop this invasion. ये जो trophoblast invade करते हैं like this, when this trophoblast invade into these spiral arterioles, converting these thin arterioles into big channels, mother stop this invasion. It is a way of showing that mother is not accepting this new antigen. So mother stop the second wave of invasion. This invasion happen in two waves. When these endometrial vessels are invaded, that happen within 12 weeks, it is called as first wave. When the myometrial vessels are also invaded, that is the second wave, happening at 12 to 16 weeks. So mother stopped this second wave of invasion. As a result, these thin arterioles stay thin. They do not turn into low resistance channel. And hence that huge amount of blood that should have come into this intervillous space, that is reduced, resulting in hypoxia at the placental interface. There is decreased perfusion, there is hypoxia. And whenever there is hypoxia, there is release of systemic inflammatory mediators. It is like a systemic inflammatory response. All these mediators from the placental interface travel to the mother. So what happened? Mother tried to stop the trophoblastic invasion. Mother is trying to show that I'm not accepting this new antigen. Hence there is hypoperfusion because spiral arterioles are thin. There is hypoperfusion resulting in inflammatory mediators that travel to the mother, and these anti-angiogenic factors and metabolic factors result in a very important thing, endothelial cell injury. So there is injury of the endothelial cells. And endothelial cells are located everywhere in human body, in all the blood vessels, in all the organs. So when the endothelial cells are injured, what will happen? What is the function of endothelial cell? First, it produces nitric oxide. So one function of endothelial cells is they produce nitric oxide. So when the endothelial cells are injured, what will happen? The nitric oxide production will decrease. Nitric oxide is a vasodilator. So nitric oxide will decrease. Very important first point. Then prostaglandins are local hormones produced by again endothelial cells. So now there is imbalance. What will happen? The thromboxane A2, which is a vasoconstrictor, it will rise, and prostacyclin PGI2, which is a vasodilator, that will decrease. So there is imbalance. Next, these vessels, when something is injured, जब भी आपको कहीं चोट लगी है, when there is injury, that area becomes very sensitive. If you touch even that area, it becomes very sensitive. So the vessels become now very sensitive to the vasopressors. The vasopressors traveling in our body like angiotensin, aldosterone, it becomes very sensitive to them. So three things happened. There is decrease in nitric oxide production, imbalance in prostaglandins, and vessels become very sensitive to vasopressors. All this because of these inflammatory mediators. If I have to be specific about these inflammatory mediators, there is decrease in the angiogenic factors. Angiogenic मतलब जो vessels को बना रहे हैं. It means the good factors. There is decrease in the angiogenic factors, which are VEGF, PIGF. Whereas the anti-angiogenic factors, it is simply understood, anti-angiogenic factors will rise. So everything bad is rising. Anti-angiogenic factors are SFLT1 and endoglin. These rise and angiogenic factors decrease. So this is clear that endothelial cells are injured and these things are happening. Now let's see. So when this normal endothelial cell is injured, see, can you see there are gaps in between, they are injured. What will happen? There will be edema. The fluid will leak out, resulting in edema. There will be proteinuria because the endothelial cells of the kidney are also injured. There will be improper tubular absorption. That will not happen. Thrombocytopenia. The platelets will come and try to plug these injured areas. And when they plug these injured areas, there will be consumptive thrombocytopenia. Platelets will be consumed, resulting in thrombocytopenia. And when there are so many platelet plugs are formed, when an RBC is passing through this vessel, it will result in mechanical hemolysis because of these platelet plugs. So there will be hemolysis, and hence when the fluid is going out, there will be hemoconcentration. So there is edema and hence hemoconcentration. There is proteinuria. Platelet plugs will form, thrombocytopenia, and these platelet plugs will hemolyze the RBCs. This is what is happening. What is happening at an organ system? Because the vessels have become very sensitive to the vasopressors, there is generalized vasospasm. Now they are sensitive and now there is vasospasm generalized, resulting in hypertension. What is happening at each organ? In the lungs, because there is endothelial injury, there will be pulmonary edema. In the liver, at some places there is injury, at some places the vessels are very constricted because of hypertension. So there is periportal necrosis and hematoma both. So at some places there is necrosis, at some places there is hematoma. As a result, the liver enzymes are raised. In kidney, there is something called as endotheliosis. Endotheliosis मतलब kidney की vessels कैसी होती हैं? Kidney की vessels, if I can show you a bigger section, kidney की vessels में fenestrations होता है. अब if this vessel, endothelial injury has happened, this vessel has swollen because of injury. So these fenestrations will be reduced. If these vessels are swollen because of injury, उनके बीच में जो fenestrations हैं, that will reduce. इसे कहते हैं glomerular endotheliosis. So there will be glomerular endotheliosis. There will be proteinuria. What is happening in brain? Just like liver, at some places there is ischemia because of vasospasm. At some places there is hemorrhage. So there will be so much of cerebral stimulation resulting in headache, visual disturbance, and eventually convulsions and coma. All that started at the placental interface. So something will happen there also. There is the hyperperfusion, that is the reason. So obviously there will be IUGR, oligo and deranged Doppler. So all this happened because there is endothelial injury resulting in vasospasm and resulting in leakage of the fluid. What is glomerular endotheliosis? Can you see? This is a normal glomerular endothelium, normal vessel endothelium. Now when it is injured, it is swollen here. And because of this swelling, can you see the fenestrations have reduced? So this has reduced. Now how will it filter blood? If the gaps are reduced, how will filtration happen? As a result, glomerular filtration rate decrease. And if it will decrease, creatinine and uric acid will rise. So that's all is happening in case of preeclampsia. Now let's see if you can solve this question. So women develop preeclampsia at 28 weeks. Regarding the abnormality, she has been counseled. What is the cause? Poor invasion by extravenous trophoblast of arcuate arteries, poor invasion of extravenous trophoblast of spiral arterioles, या poor invasion by villus trophoblast. So invasion is because of extravillous trophoblast. Villus trophoblast तो villi बनाता है, extravillous trophoblast invade करता है किसको? Spiral arterioles को, right? Which does not fit into theory of preeclampsia? It is also a previous year question. Prostaglandin play important role? Yes. Thromboxane A2 decrease, PGI2 increase. I told you every bad thing increase. Thromboxane A2, which is vasoconstrictor, will increase. Prostacyclin, which is vasodilator, will decrease. This is wrong. Endothelial dysfunction leading to reduced nitric oxide and leading to preeclampsia seems correct. Let's see. Vasoconstriction leading to ischemia, necrosis and hemorrhage and end organ damage, correct. Correct. Anti-angiogenic factors play important role, which is increase in SFLT1, FMS like tyrosine kinase, and decrease in PIGF. Correct. So this is our answer. I hope it's clear. Still any doubts? Write in the comments.